Great. So, Dr. Soin, moving on to you next, any comments on the current discussion that we are having, or any role of diet that you see in post-transplant patients that you usually advise them? Is it anti-inflammatory or anything related to wheat that you advise them or have seen in your cases?
So honestly, I don't advise diet related to gluten or wheat or so-called inflammatory diets. And of course, we all are aware that inflammatory diets are bad. Um, but to tell you about post-transplant patients, the incidence of metabolic syndrome in post-transplant patients is very high, especially people who've actually had transplants for uh, non-alcoholic fatty liver disease or NAFLD. So the incidence of metabolic syndrome for people, for the laypersons listening to this chat, that means if they're either too fat, if they have high blood pressure, they have bad lipids or high triglycerides, or low HDL, which is a good HDL, which is a good cholesterol, or have high blood glucose. So they have any of these five factors, they're called to have metabolic syndrome. Now, people who've already had metabolic syndrome and NAFLD prior to transplant will have a 60 to 70% chance of actually getting it back again. So obviously they have to be careful about diet. And people who don't even have metabolic syndrome or NAFLD prior to transplant, even they, among the adults at least, they have a 30% chance of actually developing a metabolic syndrome. And that is because of two or three things. One is because of the immunosuppressive medicines that they take. They are, one of them is diabetogenic. So some people will have mild to moderate diabetes after transplant. And the other is they simply put on weight because they feel hungry and they eat inappropriately and they don't exercise enough. So a whole lot of lifestyle advice is necessary for managing patients after transplantation. And the good diet is common to what all of us believe. The veggies and the fruits are good. Complex carbs are good. That means, with high fiber. And of course, fish is okay for the non-vegetarians. Fish is okay. Uh, Nuts are good for everyone. Seeds are good for everyone. Red meat is bad. Simple sugars and processed foods are bad. So this is general advice that we give pre and post-transplant patients. But especially, they are forbidden to have alcohol in high amounts. They're forbidden to have, like I said, the nose of the food and the diet I just said after